Hello everyone, I am Dr. Mangesh Tiwaskar. Currently, I am practicing as consultant physician and diabetologist in the city of Mumbai, and I am doing this since last 30 years. I am currently attached to Corona Hospital Mumbai, and of course I do have my own consulting at Shilpa Medical Research Center at Dahisar. I shoulder the responsibility of being the editor-in-chief of Journal of Association of Physicians of India, which is one of the most coveted journals read by the physician community of India. Friends, I am going to talk to you today about something which is very different and unique. Prevention is better than cure, and we all have heard about it, right? But ask yourself, we talk about it, but when it actually comes to the reality, we never follow it. How many times you remember last time with your family you had been out for a medical health checkup? You will surely remember going out with your family, with your kids, with your parents, with your grandparents for a hotel outing. Sunday evenings spent in the hotel. But how many times you remember going for a preventive health checkup plan? Now that is the place where I want to speak to you today. Always remember, friends, that prevention is truly better than cure. You all have to understand the importance of prevention of the disease. Preventing a disease actually reduces down the cost of the therapy and the cost of the management of the complications which are involved, primarily because of the disease related complications that doctor is likely to miss in case you pick up and diagnose your disease in a very late stage. Going for the regular health checkups, going for the regular preventive laboratory evaluations, going for the regular investigations surely not only help your doctor but will help you and your family to stop and prevent the complications of the disease. Hence, we need to understand the importance of the preventive healthcare checkups and the preventive healthcare packages which are offered by various investigation and diagnostic systems that we have in our society. Now let's see what are the different preventive diseases that can be investigated properly and that can help you and your doctor to manage the challenges. First, which is very common in Indian scenario, is diabetes. Now let me talk about diabetes and the related complications. Now we know that diabetes is a disease which can cause complications like kidney involvement. So kidney failure is very common. Heart disease, so heart attack and the related challenges are very common. Sometimes heart failure, which is one of the most commonly dealt complications of diabetes in our day-to-day clinical practice. Along with it, there is also very high risk of developing stroke, or what we call it as paralysis. Diabetes can also cause diabetes nerve and foot related problems. So you can develop the gangrene of the foot, or you can develop the neuropathy, which is sometimes very difficult to treat. And how do you evaluate your diabetes? By doing a fasting and a post lunch blood sugar, and along with it, sometimes your doctor can suggest you to go for a test which is called as HbA1c. Now this HbA1c is generally an investigation which is usually done to evaluate last 3 months sugar status of your body. Now along with it, we can also look at the cardiac challenges or the heart related challenges. Those are also another common problems in the Indian society, and especially in India, cardiac challenges are nowadays becoming very young. I mean to say, now a younger and younger population have started developing the diseases like heart attack or cholesterol. So how do you evaluate these packages of diseases? Number one is looking at your various cholesterol profiles. Now what are the cholesterol profile investigations? First is usually total cholesterol. Then also you evaluate triglycerides, LDL cholesterol, HDL cholesterol, what is also called as a good cholesterol. And of course, in very few select scenarios, there are some special cholesterols which are tested, which are also called as lipoproteins or apolipoproteins. Now that your doctor will suggest you. Now, along with the various cholesterol profiles, sometimes your doctor can suggest you to go ahead with investigations like 2D echo and stress test. Now that totally evaluates your heart's general physical as well as the functional condition. Along with it, thyroid diseases are also very common in India, and hence sometimes at least once in 6 months your doctor will suggest you to go ahead with the basic thyroid profile evaluation, and the commonest test that is suggested is usually TSH. Sometimes there are few special thyroid tests like free T3, free T4 or total T3, total T4. Sometimes thyroid related antibody tests are also recommended by the treating physician or the doctor. Lastly, I'll talk about one of the most important vitamin deficiencies that we get in India, that is vitamin D deficiency. You will not believe, despite of such a robust sunlight that we have in the Indian conditions, we encounter lot of patients in our day-to-day clinical practice with moderate to severe vitamin deficiency, and we get surprised why Indian population, despite of such a bright sunshine we have, develop this vitamin deficiency. And the reason is this, that even though we do have got sunlight, but unfortunately the enzyme which is necessary to convert this sunlight into an active form of vitamin D, which is usually present in the skin, is usually deficient or even sometimes absent in the Indian population. Hence our Indian population is extremely vulnerable to develop vitamin D deficiency, and that is the reason why sometimes you have to also in your healthcare evaluation also have to go for the vitamin D3 levels, which will help your doctor to not only take care of your vitamin D3, but by doing that your doctor would be taking care of your bone and mineral health. So friends, it is very important for all of us to understand the importance of the prevention, and to have prevention plans deployed successfully, we need to understand the importance of the preventive health checkups. Do utilize these facilities, and please join hands with all the medical fraternity to stop the onslaught of not only the non-communicable challenges that we have, but also the preventable challenges that we have. The diseases like diabetes, cholesterol, thyroid, high blood pressure, premature heart problems, and to certain extent some cancers can be also prevented. So understand the importance of preventive care, use it and make it a habit of living a healthy life. Thank you. Bye-bye.